Everyone, thank you so much for joining us today. I'm Margot Price, the Director of Alumni Relations for the School of Public Health and Tropical Medicine. Today's webinar, Women in Leadership Roles in the Field of Public Health, will host our moderator, Janine Azari, class of 1994, also the current president of the School of Public Health and Tropical Medicine's Alumni Association Board of Directors. Our panelists are Alexandra Duncan, class of 2004, and Katrina Jones, class of 2003, who will speak with us today about their professional journeys and how they got to where they are now. Each of these three incredible alumnae have achieved so much in their careers thus far. I am honored and humbled to have worked with them on bringing this webinar together today. Please feel free to utilize the chat feature to ask any questions you may have of our panelists or our moderator. I hope you enjoyed today's webinar, and thanks again for joining us.
Thanks, Margot. Good afternoon, everyone, or good morning, and welcome. As Margot mentioned, I'm your moderator for today's webinar and the president of the School of Public Health and Tropical Medicine Alumni Association. A little about me. I am an oncology senior field medical director, breast cancer at Pfizer. I'm located in New York City. So without further ado, let's begin this insightful discussion on paths to leadership in the field of public health with our two dynamic School of Public Health alumni, Katrina and Alex. So let's start with Katrina. Tell me about you, why you choose Tulane for your education, the role you're in, and your career path to getting there.
Thank you, Janine, and good afternoon, everyone, or good morning. My name is Katrina Jones. I'm originally from Alexandria, Virginia. I currently live in Washington, D.C. I chose Tulane because at the time, Tulane just made a lot of sense for me. At the time, their international health program required a second language as part of completion. And at the time, other programs weren't doing that. So I really thought the program was interesting. I was excited about it, and it just made sense with my professional goals. I'm currently the branch chief in the HRSA, in the Health Resources and Services Administration, which we call HRSA. I have served in a capacity as a special projects coordinator, as well as the director of operations in a health center. I am a mom. I have 2 dogs. I enjoy hiking and nature and good food.
Thank you, Katrina. Alex, the same question for you. Tell me about yourself. Why did you choose Tulane for your education, the role you're in, and your career path to getting there?
Great, yes, thank you. So I'm Alex Duncan, I'm from Philadelphia. I'm a proud Eagles fan. And I have a brown skin and black curly hair, and I'm wearing a black shirt and have on a pearl necklace. And I'm sitting in my home office that has a chair in the background and degrees on the wall. And I use she and her pronouns. So I graduated from college early, and there were very few programs that allowed a January start. So the list was short. And plus, who doesn't want to live in New Orleans? So I currently work for the Pew Charitable Trust as a senior officer, and I'm in their Washington, D.C. office. And I work on Pew's substance use prevention and treatment initiative. So a lot of my work is at the intersection of substance use disorder and policy. And prior to coming to Pew, I worked at 2 different healthcare consulting firms, but have a long history of employment, having worked throughout all of my degrees.
Thank you, Alex. So you both kind of touched on some of the roles you've had in getting to your current position. Did we miss anything that you would like to share, Katrina or Alex, in terms of previous jobs that you've had leading to the current one?
The only thing I would add is that I've also worked in a capacity as a doula. So it's a little bit different than my career path, but part of public health.
Interesting, great. Thanks for sharing that with us. My next question for you both is, how did you land in your current position? Was it something that you aimed for, or did your career trajectory shift to get you there? Let's go with you, Katrina.
Sure. So I would say that each part of my career path or career journey has been a stepping stone to my current career, to my current position. Most recently, within HRSA, we have individual development plans. And as part of that, where we talk about, we set goals for our career and what we'd like to see for us in the future. And I stated that I wanted to go as far as I could in my federal government journey, and becoming a branch chief is part of that career path.
Thank you. Alex, what about you? Was this part of your trajectory, or did you have to shift?
Yeah, so this was part of my trajectory to be where I am. And for someone with my background, it is a little bit of a shift because after Tulane, I did an internship at CDC, and then I went to Columbia University for my doctoral degree, and then Johns Hopkins University in Baltimore for a postdoctoral fellowship. So all of that kind of leads up to a career in academia to be, tenure track or research track faculty. But that wasn't the path that I wanted for myself. So I worked, after finishing kind of my postdoc, I worked in healthcare consulting on general health topics, but not exclusively on substance use disorder and HIV, which are my areas of expertise. And I really wanted to get back to those roots and work on projects that affect change more rapidly. And so I now am at the Pew Charitable Trust, and my work is very much in my passion, working at the intersection of research and policy. And the interesting thing about, Pew, and it's very important to do webinars like this because it's very important for networking, to get to know what other people do in other career paths. But my job at Pew, I blindly applied with no networking and ended up taking a position here. So it is very important for folks to think about meeting people in a chosen career path and establishing relationships.
Thank you, Alex. So would you say the job that you're currently in is consistent with the degree you have?
Yes, I would say that it is. So my background at Tulane was in maternal and child health. And then my doctoral degree and my postdoc is all in substance use disorder and behavioral health kind of more broadly. But yes, I do think that my degree is consistent with my career path because I do work with the maternal and child health population, as well as youth and other populations of interest, or people who are currently and formerly incarcerated, people who use drugs, and people who have HIV.
Thank you. What about you, Katrina? Is your current job consistent with the degree specialty that you have from Tulane?
Not at all. I graduated with I specialized in international help and development. And as you can see, I'm DC based, and I'm actually an IT project manager in addition to being a branch chief. So it's not quite the same. I did start out early on in my career working in a health center that focused on HIV populations and thoroughly enjoyed that work. I ended up in the federal government because I kind of wanted to see the path of doing nonprofit, somewhat state level government, and then federal government, and then potentially international work. So going in that trajectory. And as an IT project manager, I am not doing any work with respect to public health hands-on, but I do support a lot of the systems that support public health work.
So how was that transition, in the sense that you had your degree in one specialty and you're totally doing something different? How was that?
Well, my in was the way that I got into federal government was because of my experience working in health centers. And I did start off doing work that supported health centers across the country. But then I also have an interest in data. And so that's how I made the shift from working with health centers to working in IT, was my interest in data collection, telling stories through data, and informatics.
Thank you. Let's shift a little bit to mentors. Who are your professional mentors and or role models? Alex?
Yeah, hi. So Dean Deborah Furholden, who's the Dean of Global Public Health at NYU, is one of my primary mentors. And she was actually mentored by Dean Leveist, who's the Dean of School of Public Health and Tropical Medicine at Tulane. And I also supported Dean Leveist in his teaching when he was faculty at Johns Hopkins. So that's one area. Nancy Vandevanter, who's a professor at NYU School of Nursing, is another mentor. At the time, she was faculty at Columbia University, where I was doing my doctoral work. And Stan Sachs, who's formerly of the National Development and Research Institutes in New York City, is another mentor. I worked for him when I was doing my doctoral work in New York City. And it's important to have multiple mentors and mentors for different things. So I just mentioned a few, but I have other mentors that I call on for specific things like negotiating a salary for a new job, or a mentor that can help me think through balancing, family and work. So multiple mentors for multiple different areas.
Thank you. And I think that's very important to understand the various roles that a mentor can serve. Katrina, what about you? Who are your professional mentors or role models?
So I'm not going to specifically name my mentors, because I do, as Alex, I have several mentors, and I've had mentors that have been unofficial mentors and mentors that have been official mentors, because I've participated in various mentor programs, whether within work or in outside professional groups. And I've had different mentors for different things, as well as I've moved within my career journey, people to bounce ideas off, people to help me navigate personnel issues or management issues, and like Alex, people to help me navigate salary negotiation and things of that nature.
Great, thank you. So since you both have had a vast number of mentors, do you mentor? And if so, how do you mentor others? Let's start with you, Katrina.
Thank you. I do mentor. I feel that it is necessary, because I've had so many mentors that it's necessary for me to give back and to mentor as well, pay it forward. So I mentor through actually Tulane's alumni mentorship program. And I've also mentored in a capacity for either my undergraduate programs as well as outside professional groups.
Thank you. Alex, how do you mentor others? And do you mentor others?
Yeah, so I definitely mentor others in a professional capacity. It's always important for me to give back to junior staff and students, because I wouldn't be where I am today without the help of others kind of pouring into me. And so I get a lot of unsolicited emails from students wanting to know about, Pew and my career, and I always take the time to meet with them. With junior staff, I always talk to them about kind of their career goals and offer recommendations on, degree programs, or invite them to work with me on a project that they have a particular interest in, data analysis, or wanting to publish in peer review, to say, please, if you have time, talk with your supervisor, make sure it's okay with your supervisor, but please come and, work with me on this project. I also mentor outside of a professional capacity. So I've been mentoring a woman for the last 10 years or so. So of course, I know her family, and that's been a very rewarding experience to see her go from high school all the way up to now, married with a child and everything. So it's important to mentor in multiple different capacities.
Wow, that has to be so rewarding to follow the trajectory of someone from the beginning as they are still moving along. That's really wonderful. A question, what's the one piece of advice you wish someone would have given you regarding your career? Let's start with you, Alex.
Yeah, so I think one piece of advice is, have several backup plans. It's important to say that, okay, this might be my career trajectory, but what can I do to set up a plan B for myself in case I change my mind or in case that doesn't work out? And so that's, very important advice that I wish someone would have told me. And I think I've done a little bit of that. Another piece of advice that I wish someone would have told me early on is that have a resume in addition to a CV, because most people don't want to read a 10 to 20 page CV. They want a couple of pages for a resume. And if they want to see your CV, they'll ask you for it. So that's another piece of advice that I wish someone would have told me early on.
Wow, two really excellent points. I haven't heard that one about the CV versus the resume. I'm going to actually put that one in my toolbox. I think that's very insightful. Katrina, what about you? That one piece of advice that you wish someone would have told you?
So I'm going to follow on to something that Alex said, and that is that you don't have to stay in any role forever. I know when I was coming up, it was like, you have to pick this, you have to pick this position, you have to pick this career path, and you have to stick with it. And you don't have to do that forever. It can be temporary, but have a plan for sure. And the other thing is to don't be afraid to step into roles that you don't think that you're necessarily ready for. Some of that self-talk can be so negative and so damaging, but when you have people who are supportive of you and you have mentors who are pushing you and can help you, you can take on any role that that you have your eyes set on. So don't be afraid. I've had positions where people are like, you should go for that. I'm like, I'm not ready for it. And I didn't take it. And then the person that took it had the same level of experience as I did. And I was like, well, if I hadn't known that, I would have taken the role. So definitely don't be afraid.
I would concur to that statement. Definitely don't be afraid. My next question for you both is, what is the advice you would give other women that are seeking leadership roles in public health? You kind of touched upon this a little bit in the previous question, but is there something else you would share with someone that's looking for a leadership role in public health? Alex?
Yeah, I would say make sure you have a female mentor and make sure to ask her honest questions about work-life balance and her career trajectory, because I'm sure she has a lot to share. Another piece of advice is to make sure that you have, maybe it could be the same person or another person, a female mentor who's older than you, like maybe substantially older than you. I have a mentor who's a sort of a coworker, but I consider her a mentor. She's my mother's age, so she's substantially older than me, but provides advice that I'm sure my mother would provide, but sometimes it's the messenger, not the message, so that I actually listen to and take that information to heart. Another important thing about advice for other women seeking kind of leadership roles is knowing when to say no, and being able to say no and, or no and an alternative. And so so here's an example. So, someone will say, hey, can you serve on this expert review panel in this quarter? And I might say, well, in this quarter, I don't really have the bandwidth. Have you considered asking X person? Or, and say, and I'd be happy to provide an email introduction. Or another way that I use to say no is to say, no, I can't serve in this quarter, but if you have an opportunity next quarter, then I'd be happy to serve in that capacity. So that's kind of the advice I'd like to give to other women seeking leadership roles in public health.
Great advice, understanding bandwidth and offering solutions if you have to say no. Great. Katrina, what about you? What's your advice?
So my first piece of advice is to network and get involved in different opportunities. You never know where an opportunity is going to present itself, so be open. You might find opportunities, whether it's within your faith-based community, whether it's in your professional or outside network. Just get involved and network, and definitely use LinkedIn as a resource tool. It is an invaluable tool and people should learn how to use it for sure. And then the last piece is really about, and this is what I tell my mentees, is if you have an idea of have an idea of a position, or you just have an interest in a field, is to do informational interviews with people. Have your mentor or someone that you know connect you with someone and just do an informational interview about what does your typical day look like? Because oftentimes we'll look at a job description and we don't really know what that means. And I'll be honest, sometimes, you know, the people who put out the job description don't know what that means, but the day-to-day could be very different than what that job description entails. And sometimes we will not give a position a second thought because the job description doesn't look appealing. But if you ask people, and if you ask enough people, you might find that that's where you want to be.
Excellent points, Katrina. Informational interviews are, I think, almost a must now, because as what you've said, sometimes reading the job description, we're not sure exactly what the day-to-day looks like. And networking is so important as well. So thank you both for sharing those with me and with our guests on the call. Another question for you both. Can we discuss how being a woman of color has impacted your career journey? Let's start with you, Katrina.
Sure. So being a woman of color, I would say that I've always had to keep in the back of my mind that I am a woman of color, and I've had to, and not just a person of color, but a woman of color. So those two combined, making sure that my work is almost near perfect so that I remove whatever stigma comes across from that. And sometimes that can be a little overwhelming. And in places where I've been either the only woman or the only woman in person of color, it can be a little daunting. So that is how it has impacted me, is just making sure that I eliminate anything, any perceived bias about my work or about my character when I step in a professional setting.
Thank you for sharing that with us. Alex?
Yeah, I agree with Katrina. Work being near perfect resonates with me, and it surely is exhausting. And I definitely felt like I had to work harder to prove myself. And there were many times that I said something that was only heard and digested when someone who doesn't look like me said it. And so that is kind of challenging, but just reminds me why I work hard every day and why that it's important for me to be here to give back to communities that look like me.
So very important. Thank you. So a question for Katrina. Why did you decide to go in government work?
I will say that going into government was not my first choice. And part of that was because my parents worked in federal government, and I thought that I was going to be different. I thought that I would work in nonprofit and I would stay there. But what happened was I saw the need. I saw the need for people like me, people with the expertise and experience that I had working in the health center community, to really provide some input there. And I've I went to federal government and I enjoy it. I've been there for over 10 years now. I've been here for over 10 years now. I enjoy the people that I work with. I enjoy the projects that I get to work on, and I'll be here for a while.
Thank you. Alex, why academia?
Well, I didn't stay in academia, so I decided to move into something that to me was a better fit, which was affecting change more rapidly. So I love research, but the time it takes for research to affect practice, it just is too long for me. So I wanted to work in a space where we could take research, translate it to actual practice, translate it for our legislators into policy, so that way we can hopefully change lives on the ground.
Thank you. That's what I meant. Why not academia? So since we have a little time and we're doing well on time, I would like to share just a little bit about my professional experience as well, and how it pertains to having mentors, and what I call having an advisory board as well. So a little bit about my background. I have a master's in public health from Tulane in environmental medicine. I have a PhD in environmental medicine as well from NYU. So I started my career off thinking I wanted to be a professor, be on the tenure track, do a postdoc, continue doing research, apply for faculty positions. That all changed when some of the funding changed with NIH and how you're funding your lab research. So I went into industry meaning pharmaceuticals. So I went into industry as a medical science liaison. I worked for several different companies through my career journey, but getting into industry, I wasn't sure the leap from academia to industry, how that would transition over. So I've sought out strong mentors, not only mentors that can help guide me, and as you both mentioned, having mentors that serve different purposes in different age ranges so they can guide you. I also set up what was called an advisory board, where I had certain people that function a little bit different with the mentors. The mentors were guiding me. The advisors was really opening the doors for me in the sense of, I work here, let me introduce you to someone and help you get into a position. So they kind of work slightly different, but the same underlining tone to guide you through your career journey. So I've been in industry now over almost maybe 16 years plus, give or take, a little bit more, I think. I'm kind of aging myself there, but it's been rewarding. So being a person of color in my profession, when I first started, there wasn't a lot of us in this particular profession. Sometimes you would walk into the room and yes, you were the only one, but integrating, finding what works for you and networking with your current colleagues have definitely helped. And as my profession expanded to include not only PhDs, MDs, pharmacy degrees, and nursing degrees, it opened a different dynamic of women who came into my profession from all parts of the diversity spectrum. So that was a little support there in terms of networking with someone, working with someone that looked like you. In terms of leadership, I am a senior director at Pfizer. Getting there was not a small feat. You definitely have to prove yourself and excel in what you do in terms of climbing up the career ladder and having that opportunity to move up in my career has always been just really, really rewarding. So just wanted to share a little bit about my journey as well. So now I would like to open it up to a Q&A session from our guest. And Margot, can you help me if there's any questions in the chat? If not, I have a few more questions for our panelists. Okay, so question, what challenges did you face in your rise to leadership and how did you overcome them? Let's start with you, Katrina.
I would say some of the challenges that I faced, one is, internal challenges of feeling like I have the expertise, I have the necessary skills to be a leader in the space that I was in. And especially when I was I was a manager or director of operations early on, was making sure that I understood what my responsibilities were and that I was also just able to motivate staff and the people in that setting and also serve our community. The other challenges that I've faced have been somewhat similar to what Alex mentioned earlier, was making recommendations or saying certain things and it not resonating until someone else that didn't look like me said them. So those have been some of the challenges that I have faced. And as far as rewards are concerned, some of the rewards that I've had has been coming from either staff or people that have wanted to be in certain, or even mentees, or people who have wanted to get to the position that I've been in and say, I'm just so glad to see someone like you in this position and in all of the work that you're doing. And then, how do I get there? So being an example to others has been very rewarding. And then also just making a difference and an impact in the work and in the communities that I serve.
Thank you. Anything you want to add, Alex?
A lot of what Katrina said also resonated with me. A couple of other challenges is leading people who don't look like you. Sometimes they had a little bit of apprehension. And so being able to lead with humility is something that I kind of used in dealing with that challenge. Some of the biggest rewards have always been when staff come and say, I really appreciate kind of the mentorship and leadership you provided, and that you do so without being kind of overbearing. So that's always a big reward. Another big reward for me, and I'll never forget this, is I was doing work in research in a prison setting. And so many people who were residents of the jail, I think it was a prison at the time came up and said, you know what, I'm really glad to see you here doing your thing as a researcher and as a woman and as a person of color. Like, I'm really proud of you. And it was the prison residents who told me how proud they were of me to see me there in this role doing this research. And so I'll never forget that. And that's something that keeps me inspired to continue working with currently and formerly incarcerated people. And what keeps me in this role, wanting to do research with this particular population and hopefully changing policies to make healthcare in prisons and jails, better.
Thank you. That actually is leading us into the next question. Which best approach do you use to facilitate gender mainstreaming in public health program planning and implementation? Alex, let's continue with you.
Yeah, so I do a lot more of the front end planning. So for me, it's really important to make sure we're disaggregating data so that way you know who you're serving. And so those services can be planned and tailored accordingly. And it's particularly important if there are gender, race, ethnicity, and perhaps other characteristics relevant for planning. And from a policy perspective, it's also good to let policymakers know who's in need of services or who is seeking services. And you can't do that appropriately if you're not disaggregating your data. So that's the approach that I take because I'm more on the front end of the planning.
Thank you. What about you, Katrina?
I was going to say, I don't think I have an answer for this because I don't do any type of public health program planning or implementation. So I don't really have a good answer for this one.
Okay, that's fair. Another question that came in the chat. Had you always aspired to a leadership role? If not, why did you pursue a leadership role? Let's start with you, Katrina.
I would say that I typically don't aspire to leadership roles, and that's not because I don't want to. It's just that I've always felt like, well, I'm sure there's someone else that can do it. And from really early on, I have ended up being like the accidental leader. And it's not that I don't like to lead. I enjoy it. I just sometimes didn't feel like I was the right person for that position. But I've had people push and pull me along the way till I've gotten to the point where I'm like, okay, I'm claiming this. I am going to, I'm going to step into this role. I'm going to shoot for this role. So here I am.
Thank you. Alex, same question.
So
Have you always aspired to be in a leadership role?
Yeah, I think I always aspired to help people. Like that's always been why I got into public health, and I wanted to help people, and I wanted to help people who look like me. And I think I just fell into leadership roles just by the nature of the work and the nature of my interests. So I'm a more behind the scenes person by nature. Like I like to do things, I like to help out, I like to move things along, but don't necessarily need to be the face of it. But leadership roles have just kind of fell in my lap, and then I've kind of run with it. So I can't say I aspire to it, but it just kind of happened.
Right. Thank you for sharing that, because I have very similar sentiments as well. In terms of having the title, you're the leader, you lead. It's not my cup of tea per se. I like to be boots on the ground, getting things done, working as a team, because I love to hear everyone's input, because I always have this philosophy, you are just as good as your base. So if your team is solid, so are you. And so leading, that's how I lead, so to speak, but as a team. And as you said, sometimes the leadership roles just kind of fall in your lap because you actually are doing those type of functions anyway. So thank you both for sharing that with me. Another question that came in the chat. What are some of your favorite resources, such as like books, podcasts, and how do you utilize those to become stronger leaders professionally? Let's start with you, Katrina.
I have too many books to name, but I will talk about one of the most recent books that I felt has been very impactful, and that is Viola Davis's Finding Me memoir. And the reason I say that is coming from a public health background, I feel like her book really puts a face on poverty and some of the challenges that families face when they are poor. And in addition to her struggle from, being a young child to going to college to being an actress, I feel like if you're in public health, you should read her book, because it talks about the home life of many people that we just don't see, and they could present as like they're fine. And there's nothing going on in their home life, but oftentimes we know that that's not what's happening at home. And I'll just say blanketly, I typically read tons of different books from different genres to give me ideas on being a stronger, either a leader, a professional, or even a storyteller, because I think that that's also important. And so I tend to read books that talk about innovation, that talk about, and even podcasts that talk about innovation, creativity, and meditation and mindfulness.
Thank you. Alex, any favorite books or podcasts you would like to share?
Again, similar to Katrina, there's like too many books to name. I read one recently, it's called Think Again by Adam Grant. And this is about, knowing what you don't know and, recognizing that and kind of celebrating that. And so that's something that, I think we all kind of need to, be mindful of. And the book was just, reconfirmation that, it is not serving us well when we don't lean on others who might have, more expertise, and then us kind of elevating ourselves when we do have the expertise.
Yes. So shifting just a little different, what do you both like to do for fun to manage the work-life balance situation? Let's start with you, Katrina.
So I definitely feel that work-life balance is really, really important. I know that my days are pretty hectic and pretty busy. And when I shut down for the day or for the week, I need to re-energize and get reinvigorated. And I often do that by either gardening, being in nature. We have a park near our house that I like to take long walks and do some bird watching. I also play with my daughter, who keeps me curious and also active. And then sometimes it's like watching a really good documentary or a good book just to kind of decompress or have fun.
Thank you. Alex, how do you manage the work-life balance?
Well, sometimes I don't manage it well, but when I am managing it well, I do like to work out. And that is, I'm very strict with my workout times, because for me, it's not just about physical health, it's about mental health. It's really a break for me. So I schedule that into my schedule and I do not deviate from it. It's like a meeting that I'm having with a boss. And so that's very, protected time for me. Like Katrina, I do like to garden. I live smack in the middle of the city, which I love, but then, the nature part is kind of hard. So I started urban gardening. And so I really love urban gardening, except I struggle with the squirrels stealing the food that I produce. And so even though they steal the food, I still love, the act of planting something and watching it grow, and hopefully, consume it if the squirrels don't get to it first.
Thank you. Actually, I've learned something about both of you in terms of managing the work-life balance that I need to take away myself, because I don't always do a good job at that. I do struggle with managing the work-life balance, and I definitely need to do better at it. And I do have a few hobbies. One of my hobby is, whenever I'm traveling, I take pictures of mailboxes. And my plan is to have a collage of pictures from around the world from my travels into a coffee table book. But my latest obsession, since it's been the pandemic and we're doing a lot of work from home, I live in New York City. I live in a pre-war building. So across the street from me is another building. There's this lovely dog that sits in the window every morning. So I've been taking photos of this dog every morning in different positions. I've been trying to take the photos every day to do like a whole month, so I can do like a collage of pictures of this dog's movement. But on the weekends, I guess the dog and its owners go away, so I don't have pictures on the weekends. But this morning, the dog was in the window. I phoned my sister, said, "Ah, my first picture of the dog actually standing on all fours." I was so excited. So that's my way of releasing, decompressing. It starts me off in the morning. I get to see this lovely puppy dog, because it's a little small animal, but it's just lovely. So I take little things to help me get through the day, and that starts my morning with a cup of tea. So thank you both for sharing this with me. So also, we have a number of students that are on the call. And I would like for you both to share a little bit about some of the courses or various experience you've had that had the biggest impact on you while you were a student at Tulane. Let's start with you, Katrina.
So the courses that I can remember that had an impact on me were the social marketing course that I'm not sure if it was mandatory, but I remember taking that course and it just really opened my eyes to really public health and how marketing influences people and the decisions that they make. I can't remember any other courses by name, but I will say that my experience at Tulane was just, it really shaped the way in which I view the world from a public health standpoint. And I'm so glad that I went to Tulane because I felt like Tulane was the best place to start my public health journey. And some of the other experiences that I had were doing outreach in the French Quarter during Mardi Gras. I remember that because it was such an idea that I wouldn't have expected or thought I would have experienced. But I ended up doing things similar to that when I worked in the health center and supporting those types of programs. So I always look back to my experience at Tulane for shaping that for me. And then the other experience that I really appreciated while I was at Tulane, even though it wasn't part of the school, but I actually volunteered and was part of a literacy program while I was at Tulane. And many of the children that I helped with reading really helped me to understand the population and the people that lived in New Orleans, as well as my cornerstone. I should not forget to mention that my cornerstone or capstone project also helped because I was in a program, or my capstone was around helping interviewing women who had not received prenatal care. And one of my interests has always been around maternal care and health. And I was going into different women's homes across the area and learning so much about the area and the people, and then also understanding the reasons why they weren't receiving prenatal care, which, coming from my experience, I didn't understand it. But understanding the barriers, which I think is foundational to public health and helping people make change, it really helped shape some of the policies that we create, some of the programs that we create, and how we can do better. And I've always carried that with me in my career path, in my career journey.
What about you?
Yeah, so in terms of kind of courses, the EPI courses stood out because now I do so much around data and using data to inform policy that without that foundation in epidemiology, I wouldn't have been well prepared to kind of do a lot of the work that I'm doing now. So if there's students or prospective students, I will say don't shy away from those EPI courses. Those are just very important for me, and I think it would be valuable for you as well. Other things, Katrina mentioned kind of outside of school experiences, those are key. So when I was a student, I worked with a professor and we did HIV prevention with the young African-American transgender population in New Orleans. And so we worked with an organization that served the community, and we did surveys on sexual risk behaviors and engaging people in treatment, HIV treatment, if necessary. And so that was a great experience for me. And then my capstone was working with an organization on tobacco smoking prevention for people who are pregnant or people who are postpartum. And so for me, who has a particular interest in HIV and substance use disorder, all of those experiences shaped my entire trajectory in continuing with the, broad area of behavioral health. And so those experiences, look outside of the coursework, because it's the time outside of school that can be very meaningful.
Thank you for sharing that with us today. So we're approaching time. So Alex, Katrina, this has been really, really wonderful. Please share with us any final thoughts that you both have. Let's start with you, Alex.
Yeah, so I mentioned kind of the importance of, work outside of school, and it's also important to build friendships. So I met Katrina at Tulane, and we've been friends, ever since. And when I moved to DC, I knew Katrina was here, and she kind of took me under her wing and introduced me to people and kind of got me acclimated here. So use this time at Tulane to really build these lifelong friendships. And as you can see, we're doing a career panel together. And so use these lifelong friendships to also give back to Tulane, which is what Katrina and I are doing now. So I just want to thank Katrina really for, really pulling me under her wing in kind of the DC community as well.
Thank you, Katrina.
Thank you, Alex. And I have to echo Alex's sentiments, because many of my friends from Tulane I'm still friends with and talk with every single day and regularly, and we catch up, if not weekly, monthly, whatever. And when people come to town, we have dinner, we hang out. So definitely build those lifelong friendships with folks. The second thing I want to touch on is something that Alex said about the people that she works with, the incarcerated individual who said how proud he was of her and seeing her in her position. Please, please, please give people just acknowledge people in their roles and in their respective positions. And I don't mean like in titles or anything like that, but if you see someone that is impacting your life, please thank them and in whatever capacity, because you just never know when you're going to get a chance to see them again. And they don't often know how they've impacted your life. And I think back to people like as far back as second grade who are no longer with us. And I never got a chance to thank them. So if you see people who are doing good work in whatever capacity, just thank them and acknowledge them.
Thank you, Katrina. Wisdoms of pearls there. Thank you. Well, we are at time. In closing, two really great examples of how to traverse a leadership path in public health and representing what good looks like. Thank you both. On behalf of Tulane School of Public Health and Tropical Medicine and the Alumni Association, I would like to thank you both, Katrina and Alex, for sharing your journey to leadership with us today. Also, thank you to our guest for attending and asking such great questions. This concludes today's webinar. Enjoy the rest of your day.